Hi, Mike Matthews, physical therapist here with the PT411. Thanks for joining me. When you're done watching this video, make sure you hit the like button. Make sure you're following me on YouTube and on Facebook and Instagram so that you can be notified when I come out with new content. Now, last week's video, I was talking about the knee, how we mobilize the knee. One of the most important things that we can do for the knee. We need to straighten that knee out. We need to stretch it out in that direction, mobilize it in that direction, get that sucker as straight as we can. If we already have good mobility, we need to maintain that mobility. So if you haven't watched that video yet, make sure you go back and watch it before you continue on with this video. Now, last video I did talk about how the quad and the hamstrings are usually nice and strong, which is definitely the case, and typically we don't have to worry about those that much. But if we have a limitation in movement, as we stretch that out, we need to retrain these muscles to work into that motion that we're gaining back. If not, we're not going to get a lot of functional strength out of those muscles in that zone, and it's just like we're not even stretching it out to begin with. So we're going to look at that quad muscle here. The quadricep muscle, as the name implies, quad, has four muscle bellies. Those four muscle bellies cross over the front of the knee joint and it extends the knee. So if we break this down here, and we'll use some markers here to show you, your four muscles here, starting off on the outside, you have your vastus lateralis. It's going to be over here on this outside. All these muscles over here are running up in this way, all these muscle fibers right here. And you have your rectus femoris here that comes up on top, and more underneath that rectus femoris is that vastus intermedius. So you have those two muscles in that region, and then you have your vastus medialis that's more on the inside here. You have these fibers that are coming down this way, and on top of that, some of those fibers kind of turn around on that medialis, if you can see a little bit down here, and start to actually turn in towards that kneecap. So you have this big extra little bulk of it right in this area right here, and those muscle fibers actually start to turn in. So not only do we have all these muscles right here, then when they contract, they're going to lift up at the kneecap right here, and they're going to extend the tibia since they go all the way down underneath right here, this tendon, and it extends right here, but we have that kneecap that's encapsulated within that tendon. So whenever we extend that knee, whenever we contract that quad muscle right there, it's pulling up on that bone that's stuck inside that tendon. And to make sure that this kneecap stays nice and healthy and in track, we need to make sure that this quad muscle, all four of these muscles are firing and working really well. We need to make sure our hip muscles are really strong so our knees aren't falling too far in or too far out this way. But this little section right here of those muscle fibers that kind of start to run a little bit more sideways as they attach to that kneecap, those especially need to be very strong. Because if these fibers over here, your vastus medialis oblique fibers, or VMO for short, when those are weak, this kneecap will start to track out sideways because it doesn't have anything to hold it in right here. Because remember, we have a very thick tendon out here, your IT band. It's nice and taut, crosses over the knee, so it's constantly pulling on this kneecap. And without the VMO muscle fibers right here, it will pull this kneecap out every single time. So not only are we going to show you how to work this quad muscle in that end range motion, in that terminal extension motion right there, we're going to show you how to isolate that VMO in this video as well. And the number one exercise that we can do to strengthen this quad muscle at that end range is an exercise called TKEs, or terminal knee extensions. And with this, you're going to need some sort of band, some sort of loop or resistance band that you're going to put around your leg here, and you're going to place it right behind that knee there. You want to stand back just enough that you're getting a decent amount of resistance against it. And all you're going to do here is drive your heel into the ground as you straighten that knee out against that resistance. The other side of it can be anchored to a doorknob, or you can tie a knot in it and close it on the other side of a door, just something to hold it into place. And you're just going to straighten that knee out against that resistance. Every last degree that you can get, you want to feel this entire quad contract all the way back, and you want to hold that there. So driving back, hold a good 5 seconds, get every last degree out of it, and give it a really good effort there, and then relax. Each time you work on this, you want to do it about 20 times for those 5-second holds. And if you don't have a TheraBand, there's a few alternatives that you can do as well. The first one, we're gonna lay on your stomach. You're gonna have your legs straight with your toes on the ground here. In this position, you're gonna drive your toes down as you straighten the knee out right here, getting to that same point where you're squeezing that muscle as hard as you can to get that knee as straight as you can. Press and hold, really good effort there. Same thing, 5 seconds, 20 times. If you're not finding enough challenge in this, you can get your ankle weights or anything that you can place on the back of your leg, and you can work on it against that resistance right there. While we're on the ground, we can go ahead and flip over onto your back. You're gonna have something underneath your knee. You can use a bolster or any sort of sports ball here. You can place the ankle weight on your ankle this time. You're gonna extend out this way as best you can. I'm gonna scoot up a little bit so that my leg is in frame here. So just straightening out here. Again, add a little bit of weight to your ankle if you need to add that resistance in there. And you're holding that one there. If these are all pretty easy for you, we can go ahead and start incorporating that VMO in this position. As far as training that VMO in there to make sure that our kneecap stays nice and in place, we can use the same ball here, but this time we're putting this ball between our knees with our knees bent at about a 90-degree angle. You're gonna squeeze into that ball as hard as you can with both of those knees. You're trying to squeeze that ball in there, and as you hold that there, you're gonna extend that side that you're working on and hold that the entire time. Hold it for that 5 seconds and then take it back down. Again, you're trying to get every last degree of that extension in there, and you're trying to squeeze that muscle hard. You gotta give this exercise a pretty good effort to be able to get the benefit from it. So holding it up there and then relaxing back down. Same thing, about 5-second holds, 20 times at a time. So to keep training your VMO, we're gonna sit up, sitting on an elevated surface. We're gonna get that same ball, and this time, instead of putting it between our knees, we're actually gonna put it between our feet, more over here, between the ankles. We're gonna start off the same way. You're gonna squeeze into that ball again, but make sure that your knees aren't knocking in. Those knees need to be straight out in front, even with your hips here. Squeezing into that ball, straightening out all the way to that end point. Nice, good squeeze going into the ball. Nice, good squeeze to straighten those knees out, holding for that 5 seconds before we go back down. You can always make this one more challenging by adding ankle weights as well. But for the first couple of times you try this, don't add any weight. Just have that squeeze into that ball and do that set of 20 right there with those 5-second holds. See how difficult it'll be. Now, if this one is pretty difficult for you, a step up to it, we can put the ball back between those knees right there. Nice, good squeeze there. And kicking out this way. Same thing, 5-second holds up there at the top. 20 times. But as this one gets easier, as it should get easier, as quickly as you can, bring that ball between those ankles right there to work on it this way. And the last exercise that we'll cover today about that VMO muscle, trying to strengthen that right there, we're gonna get you standing. We're gonna do a fairly closed stance squat. We want those feet just far enough out that those knees stay even as we're squeezing into that ball. Same thing, nice good squeeze into that ball as we're squatting down. And we're coming back up. This one, you're focusing more on the lowering, that eccentric contraction on our way down and our way back up. Make sure that we're practicing good mechanics with our squat. We're not just hack squatting it down, letting those knees go forward. Make sure that we're sitting back and those knees don't go in front of those toes there. Keeping our back nice and straight, getting a good squeeze right there each and every time. So with these exercises, it's not something that's ever too late to start. Whether we've had knee pains for quite a long time, pretty intense knee pains that are fairly debilitating, or somebody that's just looking to maintain their knees, trying to prolong their knees, trying to prevent the pain in the first place, something that we can start now. We need to mobilize those knees. Most commonly, we need to mobilize them into extension. We need to straighten them out. Again, my last video talked about that one, or this video, strengthening those knees into that motion that we're starting to gain. And I can't even begin to count the massive number of people over the last 10 years that I've seen in clinic with knee pains that responded very well to this. People finding a lot of relief from their knee pains just simply from getting that knee extension back, from getting that mobility, from getting that motion back. And make sure that we invest in our health today so that we can reap the benefits later. Again, I'm Mike Matthews with the Physical Therapy 411. Thanks for joining me.